What about those people that can't afford that, assistive services, and maybe they don't have a family that they can stay with and have that in their home?
And there are a number of programs that are provided through the Medicaid program, and our reform would keep those programs in place because the community delivery is very important, but so is the nursing home very important. You need to have both, and there are people who have no family, who have no resources, and that's why we have a Medicaid programs to be able to take care of those folks.
And Democrats keep talking about there will be so many nursing home patients out on the street because of the changes with Medicaid. Do you see that as something that's going to happen?
Under the current program, that's quite possible because the current program is just broken. We cannot afford the current program. And if I only communicate one thing to your listeners, that's it. It's unsustainable. And I don't want to see our system fall apart because we can't afford it and we can't sustain it. I want to see us address this issue now and begin reforming Medicaid so that we can continue delivering the services that are necessary for particularly this age-blind and disabled population.
And if we're, changing things the way from nursing home to these other services you're talking about, what happens to all those nurses and staff members at nursing homes?
Well, first of all, let me be clear that we are not eliminating the nursing home. As I said, we need both services, and Texas has done a very good job of blending those, of getting most of the people out of the institutions who are eligible for and for whom it's appropriate to have in-home care. There's already been most of that transition has happened. So there are very few people in a nursing home in Texas that don't need to be in a nursing home. So even though it's more expensive, it's a necessary part. It's kind of like the hospital. You'd rather go to the doctor than go to the hospital, right? So you want to get care in the community as much as you can, but boy, you'd really hate for there not to be a hospital. So it's a very similar situation.
Now, speaking of hospitals, do you feel like maybe emergency rooms might see a lot more traffic after this budget goes through?
If the needs are not met in the community, the emergency room is the safety valve, so to speak. And that's one of the things, as a matter of fact, that we feel needs to be the result of major reform is an emphasis on seeking care at the proper level. Right now, what we see is too much reliance on the emergency room already. And whether we're talking about Medicaid or we're talking about private sector insurance, one of the exciting developments has been the increased demand for and utilization of health savings accounts, where people have, as we say, skin in the game. They have a financial incentive for managing their dollars because they get to roll over. The health savings account is really their money. And one of the best outcomes of the health savings accounts, aside from the cost savings that are associated with it, is that there's less reliance on the emergency room. That's one of the things that brings down the cost. If we're really concerned about bringing down the cost, we should be turning to health savings accounts. The American Academy of Actuaries in May, a couple of years ago, showed that health savings accounts save 12 to 20% the first year, and then every year subsequent to that, they have only a 3 to 5% rate of inflation, which is about half of what is experienced under the traditional plans. So health savings accounts deliver at least equal, if not better outcomes, and they hold the cost down. So we should be turning to them wholesale. We're recommending that a bill be passed by Representative Crownover that would allow that option for state employees. The state of Indiana in 2005 began offering health savings accounts to their state employees, initially there were only 4% of the people who signed up for them, and last year 70% of the state employees signed up for them. They have already saved, even without full participation, they've already saved the state about 11% of their cost for providing health care for their employees. So they've been popular. You know, it's not like they've been forced on those state employees. The employees have saved about $8 million on their health care cost, plus they have built up about $30 million collectively in their health savings accounts. And that's their money. If they go to another job, they take that health savings account with them. If they pass away, it's a part of their estate. It's their money. And that's their experience with only 30,000 employees in the state. We have over close to 300,000 people employed. I'm not sure that number's right, but anyway, we have a lot more people than Indiana does. So our cost savings proportionally would be very, very significant. So this session, instead of the state employees just looking at what is going to be required to fill that budget hole of more financial participation, we're recommending that they be offered the option of a health savings account so that they can begin enjoying the benefits of that. And we think it's a great option. We think it's a great option not just for the state, but for the employees themselves. So there are better ways to build a mousetrap, is my point. This is an opportunity for us to do some good things in state government.